Hi, my name is Phyllis Greenberger, and I'm a lead advocate at Disability Rights Wisconsin. And I'm going to talk to you about advocacy that we do in the area of education for individuals with mental health issues. First, I'm going to talk about some individual casework that we are involved in for PAIMI priorities in the last year. DRW advocates for students when they've been excluded from school. That's one of the main areas that we focus on. So school exclusion can include suspensions, expulsions, shortened days, being in school only a short period of time, etc. We attend IEP meetings with families to help them increase the inclusion of their students in school. This can also include attending something called a manifestation determination meeting, which is held when a student might be expelled for some behavior. And we help to show if that behavior is related to the disability or related to the mental health needs, and therefore the student cannot be expelled from school. And so we attend those sometimes with parents. Another area that Disability Rights Wisconsin helps in individual cases can be in seclusion and restraint. Some students who've been secluded from school or restrained at school, parents will call us, may go to IEP meetings with them to help develop a better plan instead of use of seclusion and restraint. In some cases, we have also helped parents file a grievance with the Department of Public Instruction or complaint with the Department of Public Instruction. Another area that DRW can attend IEP meetings to advocate for students with mental health needs would be to help develop better behavior intervention plans. So to look at a good assessment being done for the student, and then to help develop a positive behavior plan to support that student and their mental health needs within school. One other area that we sometimes do individual advocacy in can be to include supports from mental health providers at school. So that might be the school social worker, the school psychologist, to support a child at school to engage in their schoolwork and to support their being in class, etc. We may also advocate for collaboration between community mental health providers, or if a student's been in the hospital, from the hospital back to the school, to make sure that supports are given to that student that are recommended by either their mental health provider or by the hospital, and to help with the transition back to school if somebody's been in the hospital. In addition to individual advocacy, sometimes DRW also does some systems or policy advocacy for special education or school issues. For individuals with mental health needs, one of the areas we've worked on both in individual cases, like I mentioned, but also in a systems way, is the seclusion and restraint issue. We worked on the seclusion and restraint law originally. We also worked on the updates to the seclusion and restraint law a couple of years ago, or in the last year or two. And one of those updates is making sure that parents are actually getting written reports anytime that there is a seclusion or restraint at school. Another systems area we've worked on is trauma-sensitive schools. That includes advocating with the Department of Public Instruction as well as individual school districts to make sure that their staff are trained in dealing with kids who have experienced trauma and best ways to set up classrooms to be supportive as well as provide supportive services. DRW has also advocated for school-based mental health supports to include collaboration grants so that districts can collaborate with local mental health providers to provide services at school and to provide support for training teachers and support for the students at school. We've also advocated for increased funding for schools to hire additional school counselors, school social workers, and school psychologists and school nurses, and have advocated for additional funding for special education services.